Welcome to the Herbal Mana podcast, where we explore how to hurt less and live more. I am Todd Bailey, CEO of Herbal Mana. Before we get started, a little disclaimer. I am not a doctor. I don't even play one on TV. I'm not giving medical advice. This is important because we're diving into something that can be prescribed, could be over the counter. So we want to make sure that we're very intentional about the information here. What I want to talk about today, I want to talk about NSAIDs. NSAIDs are very common. Often used when you've got pain, especially acute pain or chronic pain or inflammation. So we're going to dig into NSAIDs. More specifically, we're going to compare DMSO and NSAIDs and take an honest look at why we use one versus the other, why so many people are starting to rethink whether they should use NSAIDs long-term for pain management. So first, why does it matter? If you've dealt with pain for any length of time like I have, NSAIDs were probably one of the first things that you reached for. NSAIDs include things like ibuprofen or naproxen, sometimes called naproxen sodium, or maybe both. Maybe you do like I do or used to do, switching back and forth between the two and maybe sprinkling in some other prescriptions and things like that. If that's you, let me say that this is something you need to know. This doesn't mean that you've made a bad choice, bouncing back and forth between ibuprofen and naproxen. It's common. That's what we're told to do. We're told that we should be able to take a pill and make it all good. But there's more to it. Now, NSAIDs themselves, they can be over the counter. They can be prescribed. I've had both. Most people assume that if something is available in a normal channel, like over the counter or prescribed, then it must be safe, even long-term safe. But, well, that's not exactly it. Here's the quiet part that a lot of people are finally saying out loud, and that is, I'm not sure that this is something I want to do long term. I want to be reliant on this. And that's important because it's not just the fact that you're relying on a pill. It's what that pill can do. So if you've had that thought, you're not alone. You're not imagining things. All right, let's back up a little. What are NSAIDs? NSAIDs, that's an abbreviation for non-steroidal anti-inflammatory drugs. And they're pretty awesome. They work by blocking enzymes that drive the inflammatory process in our bodies. The inflammation itself can be okay. Short-term inflammation can be okay. It helps. It's part of the healing process. We just don't want long-term inflammation. NSAIDs work by blocking the enzymes that create the inflammation that could lead to pain. So the NSAIDs knock down the enzymes, which can knock down the inflammation. Okay, short-term, potentially. For short-term situations, this could be helpful. So if you've had some sort of injury, maybe a sprained ankle, maybe your back is aching from working in the garden, or you could have had a flare-up, and maybe you've got fibro and you've got a flare-up, or some other acute pain, then perhaps NSAIDs could make sense. That's what they were designed for. The problem starts when we turn that short-term solution, that afternoon of the garden, the sprained ankle from playing pickleball, into something that is more long-term. That's when we can have a problem because the pain didn't go away as we hoped it would go away. And most people were never told, or maybe they didn't really hear or follow up about what happens if we stay on that NSAID long-term. So let's take a peek at that. But first, the short-term downsides. For some folks, even short-term use of NSAIDs can be problematic. For quite a few people, they can have stomach upset, stomach irritation, digestive discomfort. It's not great for your digestive tract. NSAIDs will be taken orally, so they're going to hit your gut, your intestines, and all of that can be affected. Now, the pain itself can be muted, which is kind of the point. You're going to mute the pain in that short term. But because the pain fades temporarily, it's easy to assume that the issue has been handled. But inflammation can spring back up again. It has a way of creeping back in, especially when the underlying causes have not changed. We've simply put a Band-Aid on the issue for a little while. That's often how once in a while starts to become every day. Been there. It's exactly what I did for a very, very long time. Now, as far as long-term NSAID risk, this could be even worse, much more concerning. This is where things deserve a serious pause. The Cleveland Clinic, an outstanding outfit, advises that with over-the-counter NSAIDs, you should not use them more than 3 days if you're using them for a fever, or than 10 days if you're using them for pain, unless your doctor or other healthcare provider is monitoring the use of the NSAID. It shouldn't be used in a cavalier fashion. You shouldn't just be popping the pills. Yeah, that's exactly what many people do. And they'll take them every day for months or even years. Medical professional societies, they consistently and responsibly recommend that NSAIDs should be used at the lowest effective dose for the shortest possible time. That's because of the long-term problems that come with long-term use. So we want to make sure that we're not turning this into a long-term problem. If we do, then we're going to start falling into the category of the long-term users that have been studied. In fact, one of the studies said that NSAID use showed increased occurrences of peptic ulcers, not good, gastrointestinal bleeding, been there, kidney failure, haven't had that one yet, and increased occurrence of stroke and heart disease. Chronic NSAID use, so when we get into the habit of using it for weeks and months, maybe years, has also been shown to worsen existing conditions like the heart condition, the high blood pressure. A European study found that 97% of people with chronic pain used NSAIDs for more than 21 days, far beyond the label recommendations, far beyond what the medical professionals are recommending. That's pretty common. In fact, if you watch the commercials that pop up on TV for NSAIDs, ibuprofen, naproxen, things like that, it makes it sound like it's an okay, everyday sort of thing. And it's really not. The longer you use it, the more likely you're going to have problems. 1% to 2% of people that use NSAIDs for 6 months run into the intestinal bleed. If you get to the year mark, that can rise up to about 4% of people that have an intestinal bleed. Not good. And also you can do a lot of kidney damage, even eye damage. Don't want to go down that path. Got to find a better way. So just go easy. Don't be on this long term and start looking for a better way. Now, the process itself or the problem itself, it's not really rooted in doctors. Doctors are trying to take care of us in the short term, at least when we have something like an ankle sprain. So this isn't about blaming the medical professionals. They're doing exactly what they were taught and used to what we're asking for. I go to the doc, I'm in pain, I want relief. So I might get recommended an NSAID or some other prescription. And that helps me to manage the symptoms quickly and effectively in the short term, but I've got to be thinking more long term. The real issue is not necessarily being addressed. I've got to do more than just the short-term Band-Aid. I've got to look for a better outcome before my issue becomes a chronic issue. Now, personally, I've had way too much experience with NSAIDs. I went through a period of time when I would see my various physicians. I would get whatever anti-inflammatory prescriptions I could. And in between, I would fill in with ibuprofen. I'd stay on that with a high dose until I would have some kind of intestinal issue, typically an intestinal bleed. Then I would switch to naproxen. I would do the same thing again until I would have intestinal issues. Not smart, but that's kind of how I coped. I've had, 20 orthopedic surgeries going all the way back to my sophomore year of high school. Shoulder surgeries, back, knees, foot, ankle. And then, of course, all the normal sports injuries, sprains, and things like that. So I got into quite a habit of using the NSAIDs. They were just a part of my life for years. And they helped until they didn't. And oftentimes, like a lot of other drugs, I would use the NSAID, I'd get some relief, but then over time, sometimes days, sometimes weeks, they wouldn't work as well. Just maybe took the edge off for a matter of days. And after that, just didn't work well. But I got the side effects, all those nasty side effects. And we don't want to get that. We need something that's going to work a little bit better, more long-term, so we don't turn into something like I was, kind of an over-the-counter drug abuser. Don't want to have that. So we want to look somewhere else. Now, initially, I didn't look somewhere else. I was looking to medical professionals. All the way back in high school, I had an orthopedic surgeon that was prescribing NSAIDs and opioids so I could play basketball. I'd already had knee problems. I got a full knee reconstruction as a sophomore in high school. My senior year, my knee was already a mess. I just wanted to play ball. I went to the doc. He gave me the prescription. Can't remember the name of it, but it was some sort of NSAID. I was able to play basketball, play through the pain because most of the pain was gone because of the NSAID. But about halfway through my senior year, I developed some kind of kickback from the drug, something that made it so I had to get off the drug. It was causing anemia and some other problems. And then I knew I was in trouble. I realized at that point how badly I had damaged the knee. The NSAID worked. It masked the pain, but it let me cause a lot more damage to that knee. And I ended up with my second surgery after that basketball season. Not a great way to manage the pain. I had to find a better way. And I went through a long period of time where I used and even abused the NSAIDs before finally going down a better route, finding better ways to manage the inflammation, finding better ways to manage the pain. And that led me to, well, maybe I shouldn't, it led me, my wife led me to look at alternatives. One, I knew about growing up on the farm. I knew about DMSO, dimethyl sulfoxide. That's the sort of thing we use on $1 million racehorses because it just plain works. and it's pretty inexpensive. If we get it in a pharmaceutical grade where it's purified for human use, it can be just wonderful. There are all sorts of things we can do. And it helped me to move from chronic pain and chronic conditions to a pretty good quality of life. I get to do a lot of the things now I couldn't do even 10 years ago. 10 years ago, I couldn't golf 9 holes. I couldn't make it without popping pills. Now I don't pop pills. I golf the 9 holes. I hit the gym 4 or 5 days a week. So it's great. Now, there's some things about it that I really like with the DMSO. I typically use it topically. Now, it can be used orally. We just don't go down that path because it's a little touchier. But topically, I can use it. And one of the reasons I like it topically is it will handle the pain and help with the inflammation, and it will do so at the cellular level. I'm actually getting some repair. I'm not just putting a Band-Aid on. I'm not slapping a pill on to mask the symptoms. DMSO will interact with cell membranes. It will pass through the cell membranes and actually affect underlying problems in the cells, the inflammation and such. And it's awesome. It'll actually penetrate my skin, penetrate the tissue, and take essential oils or magnesium or other things into my body that I want. And it will do it at the point of application. So I'm not popping a pill that affects my entire body. My knee might hurt, but if I pop the NSAID, my entire body's going to be affected, including that intestinal tract that I was tearing up years ago. Now I just apply it in the affected area. My knee is the problem area. That's where the DMSO and other things go. So I focus and I'm getting a lot better result. And that difference alone changes the conversation for many people, especially those dealing with long-term inflammation, scar tissue, post-surgical stiffness, fascia issues. We can go right to the problem area without affecting our entire body. Now, this isn't about magic or miracles. It's just about a different philosophy. It's about more targeted relief, more targeted treatment where I need it. As far as DMSO and NSAIDs typically oral, systemic, very helpful, but can damage other parts of me that I just don't want the NSAID to be affecting. DMSO, it can be topical. It can be very targeted. It can be in a very specific area. NSAIDs will affect the whole body, but topically with DMSO, I'm getting it where I want it to be. And I'm getting it there very intentionally and without a bunch of side effects. With DMSO, the worst side effect I typically face is if I use too much DMSO, I get a little skin irritation. That's just because DMSO is doing its thing. As it passes through the cell membranes, it's grabbing onto water molecules. That's why sometimes if you put too much DMSO on, you might get a little irritation, maybe even some redness, might even feel like that super dry skin you sometimes get if you're in Arizona. That's DMSO grabbing water molecules. That's just part of what DMSO does. That's not that bad a downside. If I'm just going to have that irritation because I've overused a little and I need to back off. As far as good versus evil, I would say NSAIDs versus DMSOs are good versus evil. They each have their place, but I can tell you, if I get a bottle now of ibuprofen, it's going to last me years. In fact, the last time I went to use ibuprofen, it's just a couple months ago. Went to my truck where I keep my DMSO just in case I'm out and about, grabbed not the DMSO, the ibuprofen. Went to the truck, grabbed ibuprofen, went to take a couple, and they had all fused together. They'd been in my truck a couple of years. I couldn't even remember for sure when I bought the ibuprofen. I use so little now, whereas before, gosh, sometimes I would take 10 or 12 a day just to cope. So just kind of rethink what you're doing. Go easy on the NSAIDs. Go easy on anything non-natural that affects parts of your body that aren't where you're really having your issues. Try to do something that's sustainable, something that will lead to long-term health and wellness so that you can get back the movement and the joy back into your life that'll help you move and travel and work, be with the grandkids or whatever it is you want to be doing. And make sure that you're picking something that doesn't come with a terrible cost later, like I was doing when I was overdoing the NSAIDs. That will help. That's a lot better approach. Get away from the NSAIDs, move to something natural, something that's going to be a game changer and something you can maintain for a lifetime. And here at Herbal Mana, we like to provide this kind of education. We're going to focus on topical ingredient-driven options that help people to understand how to hurt less and live more and get back into life. If you like this video, please subscribe and like and share and provide any comments you have, any questions. I try to get to those frequently. We'd love to hear from you. Thank you.